Hello and welcome to Health in the Heartland, a program dedicated to the health issues that affect you. I'm Karen Blakelock. In this episode, we will focus on concussion. Hardin Memorial Health has opened a concussion clinic, the first in the area to address evaluation, treatment, and recovery of concussions. Today I have guests with me, and they are here to discuss concussion and really why it's so important for you to take notice of what might happen as far as the evaluation, again, how we can work with you as far as recovery and even evaluate you for possible treatment. Eric Oliver is the coordinator of sports medicine at Hardin Memorial Health. And Eric, we're going to start with you today and have you kind of talk to us about why it's so important, and we've seen a lot of rise in media attention on concussion in the last several years.
Sure, I've been an athletic trainer for over 20 years, and it's probably the biggest shift in the healthcare decisions that we make regarding an injury. Used to be there's 20 different classification systems for concussions, so everybody is being treated so differently. Sometimes you'd be out for a week, sometimes you'd be out for 3 or 4 days, but as we progress and new research came out, it realized that it's so individualistic. We need to treat each person individually of how they respond to the concussion. The Zurich study of 2006 really set the stage. It's when a bunch of neurologists from around the world came together and they realized the way we were treating it was wrong, and that the brain actually needs more time to heal and needs a process to go through instead of just a timed out process. And so what you saw is a lot of news came out obviously about the NFL players, concerns in the high school and college ranks with concussions. And so in response to that, HMH stepped forward. We went to get some training done in Pittsburgh on what it involves, and we did that through Dr. Mickey Collins up in Pittsburgh with him and another gentleman that helped produce the impact test. And because of that test, all of our high school and middle school athletes in Hardin County get tested with that. It's a baseline test, but it allows us now to manage concussions better, and it's a much better way. And so now we're not looking at people saying you're only going to be out for a week. It's you're out indefinitely until we have completely healed the brain from what the injury occurred.
You've hit on some good points, and I'm going to ask Heather, who's a physician's assistant and working in the clinic area here at Hardin Memorial Health, to tell us a little bit about what is a concussion. And I know Eric's been addressing concussion from a sports angle, but you can actually have a concussion from other injury too, and we heard the word brain. So tell us what actually is a concussion.
A concussion is a traumatic brain injury where the brain gets somewhat bruised. However, there's no bleed or any other deficit in the brain. The patient may experience loss of consciousness or may not. However, after the concussion, they have a wide array of symptoms that can affect their daily life.
And a concussion we've been talking about, it's not just related to sports injuries. It can occur from other injuries to the brain, such as
like a car accident, or I've seen people that have fallen in their house and hit in their head. Just any hit to the head, basically.
And I think, Eric, I'm going to come back to you for just a second, because I think when you have an injury, sometimes we usually can physically see the injury,
right,
but you actually can't see the injury with the brain necessarily. So tell us, and I'm going to say firsthand from maybe the sidelines, and granted we've talked about it happening from car accident and possibly a fall or something else. What should we look for? What are signs and symptoms maybe of the early evaluation process of a concussion?
Sure, you look for often the simple things like disorientation. They may have light sensitivity, noise sensitivity. They may have been knocked unconscious, which obviously is an obvious one. But other than that, you just can, often it's the players that will come and tell me, hey, so-and-so's not doing good. You know, we notice him in the huddle. He's staring to the ground the whole time. He was lined up wrong on the field for the play. And sometimes they'll be the first ones to recognize that there's something abnormal going on. And after you bring them off to the sidelines and you start talking to them, it's very sluggish speech, very nauseated, not able to respond to things real quickly. Some memory loss even can occur. And so then obviously right there, because of the new state law that came out last April, they're shut down. They're not allowed to return for their safety. And then we just go from there, getting through the process of getting them back safely.
Heather, I'm going to come back to you kind of in the evaluation process. And we heard Eric saying the loss of memory, the nausea. What are other things that you actually evaluate? And your brain is part of your neurological system. So what are we looking for?
As far as like a medical perspective, you're looking for any type of short-term memory loss or issues with their eyes or balance, which we call their vestibular and ocular system. And sometimes there's deficits on examination. Sometimes it's just what the patient's telling you. Most commonly, they'll come in with a headache and dizziness, and that can result in other things down the line that cause them problems with school or work, etc.
So just their activity of daily living may be disrupted, and
Yes.
sometimes they may have hit their head, not even known that they truly
Correct.
had that concussion, correct?
Yes.
Debbie, thanks for being here with us.
Thank you.
And Debbie Smith is actually an individual who has had a concussion. And Debbie, tell us actually how your concussion occurred and how you became involved with the concussion clinic.
Sure. In 2008, I was involved in a severe motor vehicle accident, sustained several injuries from that, as well as what at the time the ER doctors claimed that it was a concussion, but they didn't really do a whole lot with that. They worked more with what was going on with my other injuries, just to make sure that those injuries were taken care of and that type of thing. Upon arriving at the ER, I started to have different types of symptoms, such as what's already been mentioned here. But they still said, you go home, everything will be okay, it'll be no problem. Less than a week or so after the injury, then I started to begin to have symptoms similar to a stroke, to where I couldn't talk well, didn't recognize anybody, didn't know how to walk, couldn't do anything on my own, and was taken back to the ER, still told again, oh, you have a concussion, it's just after the fact, it's okay, just go home, you'll be fine. As time went on, I went through different types of therapies for the other injuries, went to see various doctors, but still never was anything addressed about the concussion, because I was having not only home life symptoms, but work symptoms, as well as symptoms within everything that I did every single day. With the job that I currently hold at that time and still do, we assist people with disabilities through various accommodations, and so I learned how to kind of accommodate myself, and was kind of hidden within myself and didn't let others know that I had other things going on, and trying to cover it up, so to speak, because I just figured that the doctor told me it was okay, that it was no big deal, that I would be okay. After many years, things went by, and I had other injuries that occurred that were still even other concussions on top of that, but it was never ever addressed or ever treated until about 4.5 years later, and it was recognized by a close friend to say, hey, you know what, I'm thinking you still have an underdiagnosed concussion, and you know what, you need to seek some treatment for that. And then found out that the clinic was coming here, that they were putting it together, and got hooked up with Heather and Jimmy at that point, and
Great.
started moving forward
And I
with
think
that.
you brought up some great points. And Heather, I'm going to ask you to kind of tell us a little bit about, it sounds like the concussion can happen, but then it can last for a period of time, correct? I mean, that's what I heard
Correct.
Debbie say. So it's not like you're over it. You may actually have some lasting effects.
Yes. If you experience a concussion and have prolonged symptoms, usually more than about 24 to 48 hours, and not properly treated, like brain rest, or if needed, vestibular or ocular therapy, cognitive therapy, sometimes it can persist because what happens in your daily life can stimulate that to prolong, and you don't recover. And so just going to work or watching TV or walking in a store and going and getting groceries can prolong the concussion if not properly treated. And so by all means, for her to have it for 4 years after a significant traumatic event is not uncommon.
Does a stressful situation within, like if it's not treated either, maybe exacerbate it?
Yes.
Because you're having to think, your brain's working harder than it would under a
Yes.
normal situation too.
And I think something too that I've even seen in the athletic side, these kids may get a concussion in the fall, and we've seen this one with one athlete. Gets a concussion, doesn't get it taken care of, whereas an A student drops to a C student, is meeting with a high school counselor about, you really need to be working harder, your grades have dropped, and never realizing it's because of the concussion. He was trying as hard as he could, but he could not understand everything that's going on in class. so his GPA dropped dramatically. He got in the concussion clinic, got things turned around, but that's an example of, sometimes it's really under the rug, so to speak, and these people really are suffering, but they've never been properly diagnosed to have it taken care of.
So it sounds like they need to be evaluated. What diagnostic steps do they go through, Heather? Are there types of x-rays or different things that happen?
Most of the time they've already had a CT scan or an MRI because of the typical ER visit that occurs right after the incident. And then we impact test the patient regardless of whether or not they have a baseline with sports.
And impact means?
Impact is cognitive testing,
Okay.
which tests on 4 to 5 different levels. Usually it'll show us if the patient is having vestibular or ocular issues, and athletes get it, they have to take it before they go on the field. And cases where with Debbie, she didn't have a baseline. However, we tested her and she was very low on most of the areas. And so that gives us a starting point and tells us, does she need vestibular therapy? Does she just need brain rest? Et cetera, et cetera. Other than that, that's the only thing we have to go on because you don't see anything on a CT scan or an MRI when you have a concussion. You just go off the patient's symptoms and their examination. And lots of times it's visual and balance that is off.